Hey guys, welcome back to my channel. Don't forget to like, share, and subscribe down below. Hit that bell notification for updates on my content. So today is November 7th. So I want to talk to you guys about my clinical rotations and how that's going. As you guys know, I went to my first nursing rehab clinical site, and that went very well. I really liked it. There was a lot of pros and cons, but overall I really enjoyed it because I learned a lot. I have grown a lot as an LPN student, and now we went to our second clinical site, which was just 2 days at a mental health treatment center, and that went, I want to say it went. I want to start off by saying that for all you future nursing students, be prepared for your mental health rotation. It will definitely take a toll on you in the aspect of being prepared mentally for these type of diagnoses, and also for the events that might happen in your in your clinical day, in those 8 to 10 hours that you might be at that facility. It's about to go down. Guys, I'm telling you, oh my gosh. So there was fights, there was a whole lot of crazy stuff going on, and I want to say it's expected because it's mental health, and these type of events are expected with those patients, but it kind of catches you caught off guard when you're not used to that type of environment. So for me, I found it to be very mentally draining. I wouldn't, honestly, in all sincerity, because I always want to keep it I want to keep it transparent with you guys, and I want to just say to you guys that I would never see myself working in those type of environments, because I don't feel like I'm fit for that. Seeing people in those type of situations and their mental health being affected in certain ways, I feel like that could also affect me, because I am a very kind and generous person, and I tend to believe people when they tell me stuff. So it's hard for me not to believe them, and just, I wouldn't be a fitted nurse for that, I would say. I can't say it's never going to happen, because I don't know if that would ever happen. Maybe it could in the long run, but at this point in my career, I don't believe that's the type of setting I'm looking for. But let me begin by saying that the facility we went to was a lockdown facility. So basically we came in, they scanned us for temperature checks, and then they asked us the COVID-19 regular questions, and then after that we would let our peer know that we're there. They would scan us in, and then they would meet us in the break room or meet us in the conference room, usually the break room first. But after the break room, we would go into the conference room, and the staff would have their conference or their morning meeting, whatever they call it, like change of shift report. And the nurse would be there, the CNA would be there, basically all the care team, which I like that, because everyone gets one report, and the LPN gets the same report. I didn't really see a charge there. I mean, I lie. The charge gets the report. The LPN gets the same report. The staff, I think they're like residential specialty technicians or something like that. They have like the special name, but they also get the same report, and everyone's on the same page. Like, everyone hears the same report. Of course, after that change of shift report, the nurse will go in the med room, and they'll do their medication report, and then count their narcotics and do all that jazz. But it was nice to see that everyone gets together as a care team, because I am a strong believer that if you communicate well with your care team, that everything will flow efficiently, and it's just gonna flow, and everyone's gonna be at the same page and know what to expect. So for this type of setting, I give those people a thumbs up for communication, because I felt like everyone was on the same page. And yeah, then the nurses, do their med counts and narcotic counts and stuff like that. And then the nurse starts preparing the medication in the med room. And let's not forget, guys, this is a lockdown facility, so the doors are locked. The staff has like a kind of like a silicone band that has like a chip in it, and they can scan in to certain places. And it's not like it's a scrub free place, so people wear like casual clothes and just like jeans, a t-shirt, just kind of blend in with the crowd and stuff like that. And yeah, so the nurse began his shift by doing, his med passes one by one and labeling them and setting them on the cart. Of course, if you are used to this kind of setting, you'll know that for mental health, those patients are usually addicted to their medication, or they are addicted to drugs, or just stuff like that. I don't want to classify anybody as anything because I don't like that. But I just want to say that they're just addicted to certain things. And that being said, they would knock the door frequently and they would say, hey, can you give me my medication? Hey, I have pain. Hey, I need this and that, and blah, blah, blah. And the line gets longer. And then the nurse would say, okay, I have this for you, or I can give you this, or blah, blah, blah. Or he would also give them gum. That was something interesting that I saw, that when they would basically max out of what they could get, like their options, and they didn't have any future medications until like a few hours down the line, he would give them gum so they can chew, because sometimes they just have that like they just want to chew something with their teeth. So I don't know what it is, but he would give them gum so they can basically pretend they're chewing something, and that can alleviate that trigger that triggers them to want more meds. But yeah, guys, so after he did that, then he would have some downtime. He would go onto the floor and just supervise, make sure everyone is okay, no one needs anything. He would shave, residents if they needed like a shave and whatnot. And also he would talk to the staff and see how they are doing, if they need any help and stuff like that. That was on day one. So day one was pretty smooth. As a LPN student in that setting, we weren't able to do med passes because of the high alert medications. Everything was just a high alert, Dilaudid, you name it, it was just all high alert. So we were not able to do med passes because of that situation. And then he allowed us to discard medication, old medication of patients who had left already. So we just wrote down the medication name, the date, and just stuff like that, and then he would sign off, and then they would get discarded. What else? Basically, the LPN is just a med pass nurse. Basically, that's it. Med passes, and that's it. If a patient needs some kind of treatment, he would also do stuff like that. But there's also the charge nurse. So the charge nurse would help out in an event that a patient is acting out and they need a high alert medication injection to calm them down, because it keeps on escalating, so they need to take action ASAP. So the charge nurse was there for those type of situations. But the charge nurse basically has to do with staffing, has to deal with intervening in critical situations, as I mentioned, fights and stuff like that, calming them down, giving them those type of injections or whatnot, and de-escalating any type of event. But yeah, guys, that was day one. Day two, the LPN that I was with also also holds a RN license. So that being said, he stepped up to the plate on the second day and was the charge nurse because they were low staffed. So he had to be the LPN / charge nurse. So it was a crazy day because he didn't see that coming. So that being said, he had a lot to do, and of course he knows the role and he knows what to do. So for him, it wasn't that bad. He did his regular routine plus some more responsibilities, and the day was really busy because once we got there, they were really riled up and there was about to be a fight. These patients were just acting up and they were just getting into it, and it was about to go down down to the floor. But yeah, just kidding, guys. But yeah, it gets serious, it gets really intense, and sometimes the patients can really I don't know how to say it, get to you in a certain way. They know how to push your buttons and stuff like that, and they can get really personal, and get into your comfort zone, and you know how that goes. So let's see what else happened. We were reading a lot of patient charts, and we got, I think, like one admit, but it wasn't gonna be on our shift, it was gonna be on the next shift. The nurse also showed us what to do and what to expect in the situation of an admit, the information that they send you. The hospital will call you and give you their information so you know what to be aware of and stuff like that. So that was interesting to learn as well. Besides that, it's pretty basic and simple, nothing really too crazy with like LPN work. I mean, it was a basic setting where the LPN just does the med pass, basically. You just have to be very precautious with the medication you give. Make sure to chart, because in that facility it was all paper. So that being said, guys, I hope you guys like this update on my mental health clinical rotation. And next week I'll be going to a clinic, so that'll be more of a clinic setting. I will also post a video for you guys, and don't forget to give me a thumbs up, like, share, and subscribe down below, and hit that notification bell. Bye guys, God bless.